art of global health.
Thank you very much. We would like to welcome you all on our 1859 webinar. Thank you very much. And the topic, we are celebrating today International Artist Day. So we related art with the health, art for global health. And we are really so satisfied with the expertise of our Dr. Suparna Sanyal Mukherjee madam and Dr. Saikat Kumar Basu, that they have accepted the proposal, and their really comments, explanations, logics are unique. So respected Agnihotri sir, for brief preamble.
Really,
And
I'm
stage coordination.
fortunate enough. We are fortunate enough to have such great speakers with us, Dr. Saikat Kumar Basuji and Dr. Suparna Sanal Mukherjee ji. The limit of topic is of no value for such great orators and such as thinkers. And our viewpoint is that everything, whatever we perform or anybody perform, it itself is an art. So celebrating International Artist Day, we are here to talk about the how the health can be engineered in an artistic manner. Because जैसे कहते हैं खेल खेल में पढ़ना सीखो या earn while learn, so play while study, like that. So of course, developing and completing our journey along with the good health principles, products, not only in India, at global level. So global health is to be achieved with the help of a artistic manner. So I am quite sure that we are going to learn a lot from our guest speakers. With these words, I again invite and welcome our guest speakers of this evening for this talk.
Thank you very much, sir. I would like to invite Dr. Suparna Sanyal Mukherjee madam first. Dr. Suparna ji, welcome again. Welcome. And really, we are grateful to you all.
Again, very good evening to the all dignitaries over here who has given me such an opportunity to say on this the auspicious topic like the art of global health. So art is a different issue and health system is another parameter. So we can combine it and we can say it the both sides of the same coin. So art is, if the art is there and the health system and healthcare is there, so conjointly or combinedly, we can conglutinate each and every aspects in our day-to-day life. So in the increasing of global connectivity and impact of the, going for and traveling system from one country to the another country. So it is a very crucial time for the people at large that they are incorporating and they are getting several types of diseases they are infected through the communication system. And this dwindling situation is giving on the, where the art is giving threatened. When the art is threatened, that means we are not timely followed the parameters which is needed for us. A series of calamities has happened. We have seen recently, we have seen the COVID situation where the people have suffered globally. And the art of living and art of healthcare, the same disease, the person is suffering all over the world, but the immunity system, the world system, and the people, those who are living in the America, people, those who are living in the Africa, people, those who are living in the India and Asian subcontinents is different. So how they can cope up? We have seen the ratio of the death ratio at America is very high, and the same cases those who are living in the the cold situation and this the temperature below temperature, that is very high death ratio in case of the AYUSH, and it is very high low in case of those who are living in the sustainable area, the temperature, high risk temperature. It has been observed, and not only that, it is the very interesting, you know, time frame where the all the people are suffering in the COVID and art of living. What is this art of living? The people, those who are living in the Montipa village as Poshim Medinipur, in the Lodashuli forest range, Lodashuli beat and Lodashuli area, these tribal people, those their socio-cultural aspect is the so high which cannot the COVID cannot touch them because they don't have any kind of mask, they haven't get any support from anyone, but their system is so high, so rich that the COVID has not touched them. How? Because their community system, and they are maintaining the social distance in the their village itself, because the houses, the 25 households are living in that Montipa, the Lodha family, and they have the 50-meter distance from one house to another house. So their social composition, that is the art of living, and they don't have any mask. When they don't have mask when they are in living in the forest, they are covered their mouth and nose with the leaf. So that leaf has giving them, protected them from this dangerous situation. That is the art of living, how they have protected themselves. This art of living is not only depending upon any kind of support from the government. There is no emotional background. There is no socio-cultural hazard. There is no health hazard. There is no socio-economic upliftment. The people are living below poverty line. They don't have, though they have the job card, but they don't get the any ration food system. No one in supply the food to them. There is no cooked food, nothing, but they have survived just because of their unity of life, just because of their innocent living, just because they are not living in the so-called urban areas and so-called people, those who are educated in this world. So in that cases, we can say that there is so many energetic and facilitated networking system which has been followed. We are living in a global village. We have the access to visit the world. We have access to live in the society. Like there is every possibilities and probabilities in front of us. So those who are practicing health system, and they are supporting, they are developing their life sustenance with the without medicines, with the naturopathy, with the system they know by themselves, and they have innovated by themselves. They are the mainly social engineer, because this highly people, I will respect them, I will salute them. Those people are really traditional people, indigenous people. They have the originality. They are more educated than us, because though they don't have the any curriculum system education, like the any degrees or diplomas, whatever may be the internet system, whatever, but they are maintaining their life in very ritualistic manners, very authentic and very ethical system, which ethics they are maintaining in their life. So that's why they are very rich in the society in every terminology and every times and every coverage, if we followed. So, in the changing context, we can say that the how epidemiology and the public health challenges we have faced throughout our system and throughout our life sustenance capabilities. It is the global decline. If we can find it out, the HIV and AIDS, when it has been happened that all over the world, so those people are innocent. They also suffered from this HIV or AIDS, because we have the prejudice. So when we know the causes of the HIV and AIDS, then we can suspect the person, those those who are multiple sex oriented, but when they are suffering from, so we are identified those persons, but it is not yet been captured or not yet been observed that the person is very authenticity to bring out the HIV or AIDS. But it has come first in the monkey's blood, because we know that we have RH system, we have the ABO system, at the same time the MN factor. When this MN factor is suddenly entered into the blood of a human being from the monkey, so it has been AIDS virus has been generated and it has been spread out throughout the world. So in that cases, if we can look into the dramatic changes of global scenario, so how we have restricted, though there is no virus has been implemented and though there is no virus has been incorporated in the HIV and AIDS. So though it is a acquired immune deficiency syndrome and the globally accepted syndrome, and the person, those who suffer in India, maybe the suffer in outer world, so they are suffer in the same categories. And it has been observed that the dramatic changes of food prices can how the disease has been incorporated in the person's life with the increasing food prices and deteriorating of the food production. And April 2008, it has been incorporated the provision of food, and it has brought it out that the provision of food productivity and food capability to the each and every individual should be parallel. At the same time, they should get the proper nutrition and proper food values in their life sustenance activities. An increase in population densities have led to the increased contact between the humans and livestock, and facilitating in that case is the evolution and transmission of zoonotic infections. Furthermore, the exceptional increase in travel over the all over the especially the fourth generations has huge implication of the infectious diseases. And at the same time, the global aviation network and they cannot protect this system, but they have the deficiency for protecting this system, generating and transmitted diseases. And we have seen this severe acute respiratory syndrome, the SARS, which is outbreak in 2003, altered the world to the inadequate international notification mechanism, because this the people, those who are suffered, this is the art of living and art of health practices as it's not yet been practiced properly, by which we cannot dissuade this the virus to rejuvenate. And the zoonotic infections began in the rural Chinese provinces, spread swiftly to the various parts of Southeast Asia's countries and subcontinent we have seen in the early days. So in that case, World Health Organization also taking the prevention measures for the all kinds of diseases. That is the art which has been incorporated in the healthcare system, and it is also existing. And till today, it has been noticed that there are so many unlike viruses which is not yet been known by us, but there is a situation anytime, anywhere we can suffer, and we are infected with the virus systems. And in that cases, there is so many scientists, those who has been working in this process, and they are getting helping us, and they are innovating some technique by the art, how we can develop ourselves for this the new generation. The new generation should not be suffer any kinds of the touchability and touchability. Then the 6th millennium development goal plays to the combat HIV, AIDS, malaria, in case of this, the SARS, Ebola. So these are the tropical diseases have historically been neglected despite affecting large numbers of people, being the relatively cheap to treat, because this is the one scientist, the professor Sir Roy Anderson, who has been assimilated, and he has worked on this the problem, and he has developed the technique how to live, the art of living, at the same time the art of healthcare. And the international policymakers, the national policymakers, global policymakers, in the 2006 there is a global network for neglected tropical diseases was formed, and they have been implemented provisions for how to treat and how to rapid impact of the treatment for eradicating of this kind of diseases. And then in that cases, the despite the division of much attention and resources of the government sector and non-government sectors and everywhere, the number of preventive measures has been taken care of, and for this art of living and the art of mechanism, the effective preventive measures do exist, and which is incorporating. And in case of that, there is the ratio is maintaining by this the healthcare system. And in these cases, it's very important that to incorporate the AYUSH system. The AYUSH is the main factor over here, how we can develop ourselves through this research and development in this AYUSH. Here, AYUSH needed the research in depth, so they can develop the in-depth research for developing their behavioral system, their curriculum activities, their sexual behavioral pattern, then the others behavioral pattern, the socio-cultural technology, socio-economic parameters, socio-economic invention. So every aspects, the economic sustainable development, economic productivity, in every cases they are suffering, and they are not even suffering, they are developing themselves in their perspectives. That is the 2005. In that case, 2005, we have been seen that the even World Summit, the world leaders also giving some kinds of pledge to start the universal access to the authentically antiviral cases. And by 2010, the countries and organizations are also scaling this problem to develop the socio-cultural aspects for the art of living system. So in that case, I also highly recommend that the Ayush have the more scientific and the step forwardness for the protecting the people at large for the development of their goal. Thank you very much. Thanks to giving me such an opportunity. Namaskar.
Thank you, ma'am. Thank you so much for your such great informations and commenting about the topic. It's a really good. When you started saying that art and this health is the two aspects of one coin, that is very, very important. And how to live healthy is itself an art. जिसको कहते हैं कि आयुर्वेद स्वयं में जीने की एक कला है. आयुर्वेद जो है हमको जीने की कला सिखाती है. So in that way, Ayurved, health and art, these are all a few words which can be put together and can be taken the essence of these words, hidden say concept. So thank you so much. Thank you so much, ma'am. Now I would like to invite our beloved Dr. Saket Kumar Basuji on the same topic. How is art important? How is health important? And how the health and art globally important for each and every living being. So I invite Dr. Saket Kumar Basuji for his comment.
Thank you, Agnihotriji. Thank you, Sharmaji. I think, like Madam has very nicely highlighted on one very different aspect of how art can be integrated with health. But I am going to talk about how art can be used for the popularization of Ayurveda. Like, we are always looking for various ways and avenues, like just our school education is one thing. I know I have come with, like, when I both Pavanji and I were invited to the Ayurveda college in Kolkata one time, and I have seen how nicely he used to have various competition organized when he was serving for Imami. Various competitions he will organize, like, taking pictures of medicinal plants and putting that name and stuff, and various competitions. The idea was to increase awareness about various Ayurvedic medicinal plants and stuff, and how this could be propagated through students so they become interested. And like say for a simple photography competition, I remember that he said, like if anyone can take 20 photos of different medicinal plants and sending it for this competition, you at least get to know those 20 medicinal plants personally. Like you get to identify them. And as you'd see, like sometimes plant identification, even for Ayurvedic acharyas, Vaids, or agronomist or botanist, is not very easy. The same plant growing in different habitats may look entirely different. Their size, girth, weight, like variation, flowering, all may look different, so it becomes difficult. So it's a very good approach. These competitions were very good approach in encouraging students to get to know the plants that which they are studying. So the idea is like you don't just not memorize the information, or you just do not mug up the text that you are learning for your exams or passing the exam, but you integrate it as a part of your life, as a hobby, as an interest. So then it becomes a full wholehearted you know um, aspect of life where Ayurveda is integrated there. So art, I think, is a very powerful tool. Many times I had the opportunity to look into what you call is ancient art. Ancient art in the means, say, for example, if you look into rock arts made by our primitive ancestors, whether it is in Europe, whether it is even in Indian caves, where they will use natural colors and they used to paint things that they regularly come in close contact, like animals, trees, plants, their lifestyle, dancing, etc. Very simplistic painting, but these things have survived for hundreds and thousands of years. And even these days we go there and we get to see, like the great bull of Altamira cave in Spain, where the bull is charging. Like this is one of the very powerful depiction of nature, where the bulls are charging. And the use of color is also a very interesting part. It shows that how animals around us were integrated with the life of our ancient ancestors. Like they were hunter gatherers, no matter as matter always mentions, because she's an anthropologist, but is also from which we all belong to some tribe or other in some part of our history, and this is how we have evolved. So that images which helps and connects us to our past can also take a very strong path in promoting Ayurveda. So I think about, like, we have so many competitions nowadays, these in college or universities, and I have seen our students, particularly the girls and even many boys, take active participation in making rangolis. These rangolis, if you look into the recent times, they are not only just motifs and design that we used to do in Navratri, Diwalis, Lakshmi Puja, and other things, or in the New Year's and stuff. Now the rangolis have become very powerful. Like many times I go to many conferences in many parts, and they will have the entire conference theme with trees, plants, molecular aspects, and everything, even medical conferences and stuff, very beautifully illustrated by use of colored sand, in which they will depict the themes of the conference and stuff, and even painting stuff. I remember there was an insect related conference once in the Calcutta University, and the student did a very innovative thing. So the department is located on the second floor of the university campus. So from the very door to the Department of Botany, on every step on either side, they made drawings of various insects that they study in their curriculum, and all of them have different uses. So as the guests are coming and as they're walking through the step, everyone has to go through these insects. So everyone, whether they're related to zoology or botany or not, they get to know these various insects. There was once a conference on pollinators, and they had drawings of various species of butterflies, bees, beetles, and other things drawn on the steps. So every guest who is coming to this conference is getting to see this beautiful depiction. And colored images have such strong impact in our life that no matter whether, even if you encourage or discourage, you will wait there. The kids are coming, they're taking pictures, they're putting it in their social media. So down the line, they're promoting the cause of the pollinators. Like, they're beautiful butterflies. People are going to know, oh, there was a conference, they talked about this and that. Same thing I also like to promote for Ayush and Ayurveda. Like, so for every conferences that we have, I think it is very important that Rangoli art be made a part of this competition. Or even those students who are coming, particularly for the undergraduate degree, postgraduate degrees, many of them are very talented artists and stuff. So to encourage drawings, like, we have college walls We have vacant areas or spaces in the college where there is always an opportunity to draw. Rather than saying Sheila loves Milu, or like, all those scratches, Anil loves Agnihotri, sorry, not Agnihotri, Anil loves Vimala. We could put beautiful pictures of Ayurveda. It could be like in the Eco Park in Kolkata. There is this eco medicinal plant garden that has been designed by Professor Mradhu Gupta, and now she's not here, she's now in Delhi. But when she was there before her retirement and stuff, you would see that even not only the plots and stuff are highlighted with beautiful plants that are coming, growing. I think they are growing 300 different medicinal plants there, commercial production, live demonstration for postgraduate students, undergraduate students of Ayurveda. But even the walls, she hired artists to draw drawings of Susruta, Jivak, various aspects of Ayurvedic treatment, medicine, pollinator plant, pollinator species, various medicinal, equipments that we use in traditional ancient Ayurveda, all are depicted and drawn in the wall. Even the toilet, like it is difficult unless you see it says male, female, use the toilet, or gents or women. It is very difficult to understand that this is a toilet because the outside wall of the toilet is so beautifully illustrated with various, aspects of Ayurvedic medical treatment. Like, there are there are diagrams of it's all depicts ancient India in that particular park or theme. But what I'm highlighting, it adds to the charm, it adds to our imagination, it inculcates interest around us. And we know we are all very proud of our past, so it encourages, it stimulates to learn about these. Like once you see diagrams of beautifully carved plants and stuff, Ayurvedic treatments, people coming for treatment, pictures of Dhanvantari, and all Jivak and everything. People who are even not related to Ayurveda, who are making a visit to the park, they're interested. They are asking who are them, why are they important, why these diagrams are there. And she has also made very small, captions and stuff everywhere, so that everything that you look at has a depiction. So while you are moving through the park, you get to see the different plants, but at the same time, the beautiful diagrams that they have illustrated by hiring professional artists to draw on the walls give a pictorial history of Ayurveda. I remember last year or the year before, the West Bengal Ayurvedic Doctors Association held an international conference in the National Library Auditorium in Kolkata. And one section they had, like, well, while guests are coming, they created a gallery on either side of the entrance door where they have highlighted on the ancient Ayurveda acharyas of West Bengal, who were pioneers at that time and has done monumental contribution to Ayurvedic practices in West Bengal. So down from 14th century, 15th century to 16th, 17th, 18th, and 19th century, they had beautifully depicted storyline of how Ayurveda developed in Eastern India, how it spread, how it was lost, how the colonial British people made, forced or suppress the use of Ayurveda, which was a traditional practice during that time of the period, and how they introduced allopathic medicine slowly over the time, and how we lost the knowledge of Ayurveda in that process, and how it has again revived. The entire history of Ayurveda for the last 500 years was beautifully depicted by sketches, documentaries, images, and everything that they could provide, even use of ancient tools. As I said, like there are earthen pots and stuff for the modern distillation that we use in chemistry labs is the same where they used to do the condensations and other things on the earthen pots and stuff. Those diagrams as well as live models were placed there. So anyone who is coming to that particular conferences is so much educated even before joining, because the museum or the show area that they organized was beautiful. So in that particular sense, I would say that while we are talking about school education and stuff, one of the workshop material, one of the training that we could have from a very early age is the depiction of this traditional heritage of Ayurveda through pictures. Even Dr. Agnihotri was talking about the books and stuff. There has been a talk about, a basic Ayurveda, very simple based Ayurveda book for children in West Bengal too, in Bengali language and Hindi languages and stuff, and translate them in English too, where they would have one side written, texts, and the left side of the page, they are talking about having images. Because we always say an image speak 1,000 words. Like one image is equivalent to 1,000 words that you are saying. So every page has like an image of an Ayurvedic medicinal plant or an Ayurveda charya, or talks about various instruments that they used to have in Ayurveda, and various aspects of modern Ayurveda and stuff. Even like every year, I have been associated with the Ayurveda Medical Doctors Association in West Bengal, which is a very, very big organization, and they also have an Eastern Indian Association too. And I do take part in their annual calendar designing. So for the last 3 or 4 years, whether I'm in India or Canada, wherever I get time, whether I'm in USA, I design their calendars in the sense that I take 12 medicinal plants that are used in Ayurveda and designate one plant with history about the plant, their Ayurvedic medicinal treatment, or sometimes the modern chemistry and stuff on one page, and with the calendar on another. And this is distributed across all Ayurveda doctors and practitioners. These are displayed in the Ayurvedic hospitals, chambers, even for private practitioners who are member of the association. They get a copy of this calendar, and they are encouraged to display it on their on their chambers, whether you put it on your wall or keep it on your desk and stuff. This year we have a special theme. This year we are highlighting on 12 monumental Ayurveda charyas of West Bengal, 12 from our ancient period. Like, so like for the last 600 or 700 years, 12 different acharyas who has contributed monumentally towards Ayurvedic practices in West Bengal will be included and incorporated. So I'm working on that. So January dedicated to Shamapada Acharya, to Shivkali Bhattacharya in December. And the way I'm doing is January starts with the most ancient one and December with the most latest one. So there will be a chronological follow-up and in pictorial form with little bit of information. The idea is that whenever this reaches the patient, whenever it reaches the students, whenever it reaches the colleges, institution, wherever they are, I am trying to work with the Ayurvedic Doctors Association to disseminate knowledge, popularization of Ayurveda. This is very, very important. Like even for the embassies and stuff where we have the fair sometimes, Ayurveda fair, the Indian embassies, Indian high commissioners always organize various kinds of trade fairs, whether it is industry, whether it is chemicals, whether it is Bollywood movies, or Indian art or something like that. But they also do on Ayurvedic practices, Ayurvedic culture, Ayurvedic tradition, Siddha, Unani. And I think there is very, very important. I have seen that they have beautifully color illustrated galleries of medicinal plants, Ayurvedic practices, Ayurvedic acharyas, how treatments are being done during ancient time. These are pictorially depicted in these particular organizations when they are having this kind of units. It has a strong impact on the minds of the people who are looking at it for the first time. So to make anything successful, because we lost it for some time and because it is coming back now, art can have a very significant it's a tool in attracting people towards Ayurveda and holistic treatment of medicine. So I suggest that every hospital that is related to Ayurveda, not to keep the walls white, or not like, I do not want to see those boring stuff of Muhammad likes Asma or Anil loves Vimala. I want to see pictures of Ayurveda and stuff, because this childish thing does not stay. Like, your college love evaporates as soon as you get into your personal life, and you see life is so hard that the love escapes through the window. But when you have these Ayurvedic pictures or the theme pictures depicted on the walls, it has a lifelong impact. People will think twice before, desecrating these walls, or, vandalizing these walls by nasty comments about teachers, or, sexual comments about something. If you have a picture of Dhanvantari on the wall, very nicely done, I think no Ayurveda student has the guts to write any bad statement under it, because it is the worshipping God, right? Like, this is where you derive your knowledge, and it has a positive attribution to our cultural tradition, heritage, and also to use the talents that the students have to beautify the walls, to beautify the galleries, and popularization through magazine, through every single angle. Anytime I write for Ayurvedic magazines, whether even if I'm writing on medicinal chemistry, I try and include as much colored pictures that I can provide to them, and they're ready to include, because this colored impact has a very strong impact on our mind. Maybe they are scientific. Images are labeled A, B, C, D, E, F, G, H, showing different parts of a medicinal plant or stuff, or from which part, which chemical is extracted, which part is used for what part. But I have seen, even if you are not reading the article, if you are glancing through the pages, at least you will peep through my article for sure, because that color picture or that collage of color picture draws your attention. Thank you very much. I think this is very favorite topic of mine, that science and arts could be integrated. Ayurveda is also a very important science, and art has a very very strong role. Like Gray's Anatomy has made anatomy popular for all medical students around the world through their beautiful illustrations. Now they have high quality photographs and stuff, but 20, 40, 60 years back, if you look into Gray's Anatomy's edition, you will see that they have they commissioned very high caliber artists to draw various parts of the body and stuff. And even in Ayurveda, I'm pretty sure in the basic classes when you are learning about the human body and stuff, there is no harm in looking into Gray's Anatomy to get an idea about the muscles, the exposure, the stomach, and all the other contents and stuff. So this is helpful for any branch of medicine, holistic or our modern medicinal path stuff. And so artistic illustrations have very strong impact, and I strongly recommend use of arts for the propagation of Ayurvedic, principles, practices, thoughts for the purpose of education and awareness. Thank you very much and good night. And I will see you tomorrow.
Thank you, sir. Thank you very much. You have just changed the real essence of the topic, that art and global health. Can't you see the beautiful, decorated, artistically displayed our Ayush Samriddhi banner made by Professor Pawan Kumar Sharma ji?
Yes,
The
yes,
great
yes,
essence,
yes.
the great
The
essence
sloth
behind it.
banner, the sloth animal that he was talking, like I think even not being a zoologist, the pictures that he had for various species of sloth is
Yeah,
award winning.
yeah.
I nominated him from Nobel Prize for on that particular day.
And moreover, what you talked about, really, we are fortunate enough to live in Uttarakhand, in Haridwar. As you told, that we also know that the Kolkata is also a very, very civilized and traditional city of our country and world. Here, you see, uh, except 2.5 years of this COVID in this unfortunate duration, we have got a wonderful depiction, because since 2020, when we saw this 2021 Poon Kumbh, the geographical system of our Haridwar changed with the help of the say so many roads and flyovers, and all the flyovers, the pillars were painted beautifully with the slogans, with the shlokas, Ganga Tab Darshanat Mukti, so many sadhu sants painting, and they are keeping on doing all these Ramayana pictures and Mahabharata pictures, right from Haridwar to Rishikesh, even to Lakshman Jhula and Dehradun. So it is wonderful. Wherever you stand in front of any ghat, you will see wonderful things. Sadhu, sannyasi, they are enjoying with their jata and throwing the Ganges water. It's imaginary. And at the same time, what you talked about the Rangoli, you see, Rangoli has become so compulsory that not only the on festive days or any day of our Indian calendar, since we spend at least 30 years in our college and institutes, we have always seen it is not only Rangoli, it's a theme Rangoli. And as you told that here on introduction day, on farewell day, on any CME day or our annual day or our alumni meet, a group of girls are there to they ask for the so many colors powder, and they make at least the peacock is one thing which is always there. And apart from that one, the theme is also written, not only welcome or swagat hai, Abhinandan hai, ya Ayurved Amrita Nam. They also go for the theme. Even sometimes they write the topic of the CME. So goes the case with the this our Paudharopan Karyakrama, 15 August, 26 January. They go for that. And one thing very important, in Kotdwar, there is a very famous temple, Siddhavali temple, and there on the ladders of the temple, on both walls, the girls are performing, sketching so many paintings. When I asked them, they were having the scaffolding to reach to the top of the wall along with the railings. They told that they are the students of graduation doing performing arts and masters, and they have been engaged for this thing and paid, say, 15,000 or 10,000 rupees for painting and means depicting this sort of good theme based say photographs of that. And also in Ayodhya and everywhere now, it has become a wall painting, except not only in the days of election, as our Mr. T.N. session completely stopped wall writing by the candidates, and the expenses will be put to the party or the candidate himself. So that was stopped. Now we are utilizing our Nagar Nigam, state district authorities. They are utilizing this thing by the help of the wall painting and saying messages pertain to the particular event or the means Kumbh or Kamar Mela. So we are here, and moreover, each and every whenever the student, it is difficult to have even a single photograph of Dhanvantari ji, Bhagwan ji. Now it is a position that this is Aushadhi say Parichay ek patrika and of J.P. Sharma sahab, and they have shown this Dhanvantari. So artistic Dhanvantari, Lord Dhanvantari's photograph, not only of North India but South India also, they are making on the walls. When we are BHU, it was difficult to have even a say portrait size this picture of Dhanvantari ji. Now we are having a full size, say I think 10 feet by 10 feet or so, good display of Dhanvantari paintings on the walls of this either Dower store or Vedanath store or good leading medical stores. They are displaying publicly on the second story of the buildings like that. So it's a great time when the wall painting and promoting the art with the help of the conceptual theme person, not to go for as you are doing. They are sketching over the trees and the walls that they have visited, say at 10,000 feet Badrinath ji or so, and putting their name. Instead of that one, Lord Vishnu is there, Badrinath ji is there. If they have been displayed in a form of the pictures and this our wall writing, it will be a great message to the society, and also we will celebrate the
We have a
art.
similar topic. We have a similar topic tomorrow too. Like we'll talk about audiovisuals used in Ayurvedic education and stuff and things. So I think that also has a very important aspect, right? When you get to see, you get for the students particularly, it is easy way of learning. So and also popularization is also important. So thank you very much. It is great. Thank you, Sharma ji. Thank you, Agnihotri ji. We'll meet you again tomorrow.
Yes,
Thank you.
sure.
Thank you very much. Good
Thank you.
night.
Thank you.